And you're all very welcome. My name is Paul Gurley. I'm an inspector with the HSA in the Behavioural Health and Safety Unit. And the area I primarily work in, along with some other hats, is violence and aggression. And this is an area that I've been developing for the past 2 to 3 years. And for my part of today's webinar, I'll introduce the topic to you and I'll talk about the employer supports that we have available. So, what is violence and aggression, and what is it as it relates to occupational safety and health? So, we don't have a legal definition of work-related violence and aggression as we do for other elements of occupational safety. But we do have a widely used definition, and this is used at EU level in our own healthcare sector and also as a regulator. And you'll see here on the slide that work-related violence and aggression can be defined as any incident where staff are abused, threatened, or assaulted in circumstances relating to their work, involving an explicit or implicit challenge to their safety, their well-being, or their health. And on the right-hand side of the slide there, you'll see the various actions that can be or can fall into this definition. So you can have verbal threats, you can have spitting, hitting, name-calling, swearing at someone, punching or kicking, and it can also come in the format of an email or a phone call. But what's also important is what's not violence and aggression. So being rude or being demanding, questioning someone, being assertive, or being critical of a service, or even being angry or frustrated might not fall into the definition of violence and aggression. Those are just human behaviors. So looking further then at what it is, although we have one hazard, it can be experienced in very different ways, and the level of risk can be very low or very high. And even within the occupations that you see here on the slide, the level of risks can vary greatly. So if you look at the variation of roles we have here, from traffic wardens, hotel receptionists, even health and safety inspectors, I could probably put up another 2 slides with occupations that may be exposed to violence and aggression. And the types of incidents can also be very variable. You can be faced with a constant level of low risk incidents, or you might be faced with a very infrequent but high level incident, high risk level of incident. And the control measures that we speak about this morning should reflect the level of risk. The authority doesn't have the expectation on employers that we eliminate violence and aggression from society. The expectation is that you put in place control measures that correlate with the level of risk that you have in place, and that reasonably practicable term comes into play here. So that's what it is, just to introduce the topic. How prevalent is the hazard? I just have a couple of slides looking at this, and this first slide is some of the highlights from a recent ESNR survey. And this is a very sizable survey which links to 41,000 establishments across all business size classes and activity sectors in 30 European countries. And what they've started to look at is the psychosocial hazards, and one of those being violence and aggression. And the survey puts having to deal with difficult customers, pupils, or patients as the third most frequent risk factor in work. It also found that only 46% reported having a procedure in place for dealing with a threat or abuse, and that 21% of employers deem psychosocial hazards as more difficult than other risks. And having spent a lot of time in the kind of more physical, traditional safety aspect of the working world, I can completely understand that they might find it more difficult, and we're hoping with our unit to kind of assist in as much as we can in terms of guidance and webinars like this, and helping employers to kind of make this a little less difficult for them to manage. So more locally then, we carried out a survey last year in the retail sector, who have a very large amount of public facing roles. And when we asked about the prevalence of this hazard, nearly 70% of employees and managers, employers, felt it was more prevalent in recent years. So we would see approximately 600 incidents a year reported to us across all sectors. But of course, we know this isn't the full picture. You have to be injured and you have to be off work for it to be notified to us. So we suspect that there's a lot of instances of VNA that we don't see. So that said, let's look at what supports we have. Max is going to talk about the enforcement side after me. I'm going to focus on what supports we have for employers to help manage this particular hazard. We now have a dedicated web page for this hazard. This web page is really a starting point for all our work and guidance. So on this page, you'll find links to all our publications, to our podcast, to our e-learning courses. I'm sure there'll be a link to this webinar from there as well. And any new material that we produce, you'll log on to this web page and there'll be a little banner to tell you this is new and you can take a look at it. So that's really a good starting point for all our assets and all our guidance. The first piece of work I carried out when I took on this role was to produce an updated guide for the management of this particular hazard. So you don't have to worry, I'm not going to bring you through a guidance document through a webinar, but I have a couple of slides just to give you an idea as to the information that you'll find within this particular guide. The document will take the employer through how to explore whether violence and aggression is an issue in their workplace. And for some workplaces, thankfully, it won't be an issue, but it is worth asking the questions. By looking at similar workplaces, and I know business owners are very good at doing that, by talking to your staff, by exploring previous incidents and exploring what happened within those incidents. And this will inform the employer about any potential risks and your risk level when it comes to violence and aggression. It also looks at the aspects that make up violence and aggression. So when you're looking at your workplace and what situations can worsen violence, you take account of the aggressor. And so in some cases, that can be a customer, client, or a guest, or a member of the public. You also take account of the employee and the work environment, and how all these elements come together will influence violence and aggression at your workplace and the level of risk that you have. And the document will go into more detail about those three aspects and how they come together. The guidance document looks at what control measures an employer can introduce. And we place these into categories. So we have your organizational control measures. So what kind of culture do you have? What kind of reporting structure do you have? We look at the workplace and the environment as well. So do you have place of refuge? Do you have alarms? How is your workplace laid out? Is it well illuminated? We also look at management and systems of work. So do you have an appointment systems that you can use? Do you have lone working? What are your procedures for opening up? What are your procedures for locking up in evening time? And there are a lot more control measures as well that we suggest within the document that can help employers to manage this particular hazard. One of the other features of the document is a suggested template for recording incidents. So the document would highlight the importance of this for us and for employers. Employers can gather info on where and when incidents are happening, and very importantly, who was exposed to an incident, who was working and may have witnessed an incident. And from this, you'll be able to gather information on maybe trends. Are incidents happening at a certain time? Is it seasonal? For example, we have a very busy season coming up for in particular retail. So is it time to have a little toolbox talk with our employees, maybe push out the training again, make sure maybe new staff who are joining are trained up. And of course, it'll also tell you, are incidents happening to just one person? Are they happening to a group of employees? And with this important information, then an employer can put in the appropriate control measures that they need. So just stepping away then from that particular document, I'm looking at our other supports. So we have produced a sample or a template risk assessment to assist employers. So employers may be more familiar with risk assessments for other types of traditional hazards, and we would hope that this helps maybe demystify how to approach psychosocial hazards. And I might refer back to the Esner survey, and that's one of the things that came up, was having these procedures to deal with violence and aggression. So it is a template, and of course employers can integrate this or elements of our risk assessment into their own safety management system. But this risk assessment went live this week. We'd encourage you to visit the website, take a look at it, take a look at our suggested control measures, and how we want to make this as straightforward as your safety risk assessments. We have your hazard, who's at risk, what control measures can we put in place to reduce the risk as much as reasonably practicable. So in the area of psychosocial hazards, we've also developed a suite of e-learning courses. So we have one for violence and aggression, we have bullying, stress, and human factors. They're short courses, they're easy to access, they're free, and will assist in learning around the area of these hazards that can often be seen as your hidden hazards. And they're accessible through our website and, of course, our own web page as well. So this document is literally, this is half the press. We are publishing our newest guide this week, and this is the guide that we produced for the retail sector. So using info from our survey in this area and feedback from employers and stakeholders, we have produced what we believe is a very practical and short guide for the management of this hazard in this particular sector. Now, I won't go through it today, to be honest, because I prepared my presentation just before we got final approval. But please keep an eye on the website, and we'll also be in touch directly with stakeholders who may be working in this area. And within the guide, we have laid out really simple, practical control measures that retail can put into place. So the next thing I'm going to talk about is our media campaign. So when I took on this role, and very much all my colleagues in the unit know that we're never going to be able to tackle the hazards that we have responsibility for with just inspection. So that's why we put a huge emphasis on both enforcement and guidance and education and training. And also we ran a media campaign last year, and we're running it again this week. So this media campaign was produced to get the message out there in terms of violence and aggression. It's not part of your job. Employers have a responsibility, but also come to our website and get information on helping you to manage this particular hazard. So I'm going to show you this first video asset, and this should be popping up this week on platforms like LinkedIn. Other platforms are available, and I'll play it for you now, and you can hear what happens. Hopefully we will have sound.
Claire, I want to know where she is.
Sir, if you could just wait here, I'll go and find out.
I'm coming with you.
No, sir, you'll have to wait.
Don't you fucking tell me what to do. Stupid.
Work-related violence and aggression, it's not just part of the job. As an employer, it's your responsibility to protect workers. For guidance and to learn more about your duties, visit hsa.ie.
So this is a very short video, but the idea is it catches your attention. It gives a clear message that it's not part of your job, and we have supports, and come to our website and avail of those. We also produced a radio ad. So the setting here is more a service area, cafe kind of setting, and you can see how the interaction goes with the customer.
Are you calling me a liar?
No, that's not.
I'm telling you, this isn't what I ordered. Don't give me that look, you little...
Work-related violence and aggression, it's not just part of the job. As an employer, it's your responsibility to protect workers. For guidance and to learn more about your duties, visit hsa.ie.
So again, that's our radio ad asset. Very short, we know, but impactful, and we're getting the same message again. It's not part of your job. Employers have a duty, and please come to our website to get information to help you manage this particular hazard. Now, I'm coming to the end of my presentation. So I like to always have a few takeaways. So selfishly, I'm going to ask people who are on the call today or on the webinar today, please visit our website, take an e-learning course, or download one of our guidance documents. And now what I'll do is I'll end my piece of it, and thank you all for listening. And I'm going to hand you over to my good colleague, Max Parry here, and Max is going to look at the enforcement side of things. Thank you.
Morning, everyone. My name is Max Parry, and I'm an inspector in the Behavioural Health and Safety team in the Health and Safety Authority. I've been carrying out psychosocial inspections now for the HSA for approximately 2 years, as well as being involved in various projects in the area of behavioural health and safety. Hopefully my presentation today will share some valuable insights with you on what to expect when an inspector arrives at the door to carry out a psychosocial inspection. So when I say psychosocial inspection, I suppose that means we'll be carrying out inspections in the areas of work-related violence and aggression and bullying in the workplace. And we typically carry out those inspections in NA sectors that would have a public-facing role. So areas such as catering and hospitality, retail, transport, and some public sector organisations. Currently, as Park said there, we have two inspectors who are splitting our time between inspection and policy and project work. And we're glad to say that we will be upping our resources in 2026. And in general, the inspections are received very well, and people are surprised and almost happy to see us come and inspect in this area. Just to give you a bit of background, I suppose, on some of the challenges that we come across on inspection. So sometimes there can be a knowledge gap there. So we might arrive to a particular retail outlet, for example, and there may be a knowledge gap there. So we might ask for the most senior member of staff on site on the day, and the assumption there is that it's a safety inspection, I suppose, and that's part of our role as inspectors as well, is to influence and education and inform our stakeholders that, we're carrying out psychosocial inspections and occupational health inspection in the areas of work-related violence, aggression, and bullying. Another particular challenge that we do come across is the ability for employers and employees to facilitate and to provide the resources to carry out the inspection. So I'll use retail outlet again as an example. We could arrive on any particular day and the manager is up the walls, they're short-staffed. Somebody might have called in sick that morning. So for them to dedicate the time to us to carry out an inspection can be a particular challenge. In circumstances like that, in genuine circumstances, we are willing to arrange a time to come back at a later time to facilitate the inspection. In retail in particular as well, sometimes we come across managers that may be less experienced employees or they're new to their role. So they might not particularly understand who we are as an organization or what we're looking for, or the location or the contents of the safety documentation, policies or risk assessment. So I suppose, again, that's coming back to our role as inspectors to influence and educate and promote our work as well in this area. Another challenge, I suppose, in particular that we do come across quite a bit in the modern day is the hybrid safety systems. So when we request documentation for inspection, some of it might be in a hard copy, some of it might be in a soft copy on a portal somewhere. So it's trying to gather all that information together and try and have it in the one area, which helps facilitate the inspection as much as possible. Some of the things that we see, I suppose, during inspection, in terms of training, I think everyone on the call here today would agree that, particularly during induction periods, that you can almost get an overload of information, and that information, it's easy to get lost in time. So we do like to see structured training in terms of psychosocial hazards, and regular refreshers provided to staff in a way that the information doesn't get lost and it's kept refreshed. In terms of risk assessments and control measures as well, we see employers doing a lot of good work in implementing control measures and safe systems of work, but then when we go to inspect the documentation and the risk assessments, the controls aren't reflected in that risk assessment. So we do like to see what's been practiced on the ground being reflected in the risk assessment and safety statement as well. In terms of bullying policies, then we also see from time to time bullying policies just being sent to employees rather than having that open communication and open dialogue of policies and procedures. And again, the provision of regular refreshers and updates regarding anti-bullying policies and procedures. So I'm just going to talk a little bit about the hierarchy of controls. So when carrying out psychosocial inspections, I often remind myself of the hierarchy of controls, which everyone here understands ultimately outlines the goal of managing hazards in the workplace by prioritizing methods that produce the highest level of protection. So for example, in terms of eliminating or substituting a hazard, instead of lifting heavy materials on a particular site, a mechanical lift could be used to reduce the risk of manual handling. Whereas with violence and aggression and bullying in the workplace, it's almost impossible to eliminate or substitute the hazard. Unless retail outlets, transport operators, and hotels physically prevent the customer from walking in the front door. So it is important to realize that as an inspector, we are not asking employers to eliminate the risk completely, but to manage the risk as effectively as possible. So where we start with psychosocial hazards really is with, the engineering controls, the administrative controls, and PPE that Park touched on earlier, such as having CCTV, areas of refuge, panic alarms, designated staff only areas, and so on. So in terms of enforcement and legislation, I suppose the majority of enforcement that we would issue on a psychosocial inspection is in the form of written advice or a report of inspection. So on the left-hand side there, you can see primarily the legislation that we do enforce on. So the written advice is based on the Safety, Health and Welfare at Work Act 2005. So the sections we would advise on are Section 19, Risk Assessment, Section 20, Safety Statement, Section 10, Training, Information and Instruction, Section 225, the General Application Regulations in the reporting of accidents and dangerous occurrences, and Section 64 as well, the powers of the inspector. And on the right-hand side of the slide there, you can see is a template of our report of inspection. So if you've had a HSA inspection and you'd have seen this before, and we typically issue the report of inspection on the spot at the end of the inspection. And this will outline any written advice on how we feel the employer can better manage work-related violence and aggression and bullying in the workplace, and how we communicate this to the employer. So in terms of the content of what the report of inspection includes, so the information that we would include there is the legal company address, the site address, a due date for response to the HSA, the actual written advice in itself, and the employee details as well. The report of inspection also provides a response slip for employers to complete and return to the inspector, such as myself and Porrick, which informs us that remedial action has been taken based on the advice provided. So when myself or Porrick arrive at the door, I suppose, as I said, the inspection is carried out under the category of psychosocial inspection, and it follows the same sequences of a safety inspection to an extent. So I typically arrive on site and I would look for the most senior member of staff that's available on the day. I would introduce myself. I have my ID and my warrant, and I'd outline the scope of the inspection. I'm here to carry out an inspection in psychosocial hazards, which is work-related violence, aggression, and bullying. From there, I would sit down and have a conversation with the member of staff that's been designated to facilitate the inspection. And during this conversation, I would typically gauge the level of risk that is associated with these hazards in this particular workplace. So how to do this, I asked the manager or supervisor, how many instances of violence and aggression do they receive? Is it weekly? Is it monthly? And in some cases, is it daily? What control measures are in place? What kind of training has been provided to employees? What training records do they have, and how often is training provided? And so on. So from that conversation, I'm able to gauge the level of risk associated that these hazards pose on the employees in this particular workplace. So from there, then I would carry out an inspection of the physical workplace. So here I would focus on the areas of the site where interaction with the public takes place the most. So areas such as reception areas, tills, bar areas, front doors, shop floors, and so on. And from here, I like to see if the control measures I've been told are in place are actually in place, and match up with the information I've received to what's actually been practiced on the ground. I'd also have a conversation here with the employees who are working, to see, how they would manage incidents of violence and aggression and what kind of training has been provided and if they're aware of the control measures that are available to them, such as panic alarms, areas of refuge and escape routes and so on. So once I've carried out an inspection of the physical workplace, I would then carry out an inspection of the documentation. So the documentation that's included here would be your safety statement, risk assessments, any training records, and anti-bullying policy as well. So again, here I'm looking to see if the control measures that are in place on the ground are actually reflected in the documentation. So, a lot of employers I've seen anyways, they're doing great work on the ground, but they're almost not taking credit for the great work that they're doing in the documentation there. So it's important to make sure when risk assessing for psychosocial hazards that all the control measures that are in place and are being practiced on a daily basis are reflected in the documentation. In terms of enforcement action then, so this is where I would issue my report of inspection, as I discussed in the last slide. So this is where I would provide any written advice based on any gaps I would have identified throughout the inspection. So, and then I would issue the report of inspection on the spot and close out the inspection. And any follow-up that's involved in the inspection as well on the enforcement, I would carry out skipping back in the weeks to follow. So we would typically give a month's time to respond to our report of inspection. So yeah, I suppose in terms of psychosocial hazards, it is a new area. And when we arrive on the day to carry out an inspection, employers and employees are surprised, but almost happy that we're looking into this area. And they're well, the inspections are well received and people are willing to engage with us. It is a small part of what we do, and because it is such a new area, we are still learning ourselves every day as well on the job. And it's interesting as well with inspection, I could introduce myself and start the inspection, and violence and aggression initially doesn't seem to be an issue with the employee or the employer. They tell me, oh, we don't experience it here and whatnot. But once we actually sit down and have a conversation, there's the realization there that, right, actually, we do actually experience this more often than we thought. And the line I hear a lot on inspection is, oh yeah, but it's just part of the job. Whereas I couldn't disagree more with that, and my colleagues couldn't disagree more with that as well. It's not part of the job. And it is a hazard to be managed in the workplace. So yeah, that's me. Thanks very much. I hope my presentation gave you a bit of an insight into what an inspection looks like, and maybe help you better prepare for an inspection in the future as well. So I'm just going to pass you over to Brian Larkin, then the Senior Enterprise Risk Manager in the State Claims Agency. Thanks very much.
Morning, everyone, and thanks, Max. My name is Brian Larkin. I work as a Senior Enterprise Risk Manager in the State Claims Agency. And first, I'd just like to thank the Health and Safety Authority for inviting us to speak here today. The risk we're discussing, it forms a very significant part of our incident and claims portfolio, and we really appreciate the opportunity to share our insight into the hazard. Before we delve in, I just want to touch briefly on the role of the State Claims Agency for those who may not be familiar with us and what we do. Essentially, we manage personal injury and third-party property damage claims on behalf of the state, and our risk universe is broad. Under the General Indemnity Scheme, which covers personal injuries to staff, visitors, contractors and others, our remit extends to over 160 or so delegated state authorities, representing more than 250,000 state employees. Our clients range from a range of public bodies. They range from the HSE, the Defence Forces, Garda Síochána, Prison Service, TUSLA, Community and Comprehensive School Sector, all of whom engage with the public, including patients, young people, students and prisoners. So this makes our risk portfolio both, I suppose, diverse and complex. And we have three core mandates, the first being to essentially manage claims and to ensure that the costs are managed to the lowest achievable level. Secondly is our risk management mandate, which is to assist and advise our state authorities in managing risk effectively to, I suppose, help prevent incidents that may give rise to future claims. And thirdly is our legal cost mandate to, I suppose, oversee legal costs to ensure value for money. And NIMS, the National Incident Management System, is central to what we do. If you're not familiar with NIMS, it's essentially an end-to-end risk management tool. It's used by our state authorities to report incidents, to investigate incidents, to identify key lessons learned and trends, and reporting functionality through dashboards and reports. We in the State Claims Agency use NIMS to manage claims, but also to analyse those national trends and emerging risks. And since its inception, there's over 3 million incidents reported on the system to date, close to 6,000 active NIMS users, and more than 60,000 people access the system through electronic point of entry reporting. So the system is very much used in the public sector and in the state sector. So just to talk about violence, harassment and aggression. So it's a category 1 risk for our state authorities, meaning it's a very significant risk. And for many of our state authorities, it's probably their top risk that they have to deal with. The European Commission definition probably closely aligns to the types of incidents and claims that we see, which is direct physical assaults, unintentional aggressive behaviour by service users, intimidation or threat, verbal assault, and sexual assault. And one of our earlier projects in this space was with the Irish Prison Service. So in 2016, we examined assaults on operational prison staff by prisoners. And more recently, we completed a piece of work with the Irish Prison Service on a closed claim analysis project, I suppose trying to identify patterns and contributing factors to incidents and claims. In addition to this, we have published 2 risk research reports, one in the state sector and one in the health and social care sector. These reports explore, I suppose, key trends on incidents and claims, and I'll be sharing some of the insights from these reports a little later. We've also engaged, I suppose, on a more nuanced and targeted level with some of our other state authorities, like the community and comprehensive schools, tailoring our approach to the specific challenges they face in their environment. So just to, I suppose, introduce some of the data. This data is sourced from the National Incident Management System. What you're looking at here is incidents reported on NIMS 2015 to 2024. It excludes the health and social care sector. I suppose what you can see from this chart is that incident activity is increasing year on year. There is a notable dip in 2022, and it may be tempting to, I suppose, attribute this to the lingering effects of COVID, but that's not necessarily the case. It's primarily driven by more operational challenges for some of our state authorities there in reporting incidents on the system. I think, in fact, COVID itself, it did not necessarily impact reporting levels. It remained very much on a consistent trajectory. What's more interesting, I suppose, is the next slide, which looks at this data in a little bit more detail. The orange bar represents a negligible severity rating, so very low risk severity rating related incidents. And what we can see here is that, yes, incident activity is increasing, but there's a higher reporting of those negligible incidents, thus probably illustrating that this is probably more a cultural shift to more diligent reporting practice rather than an actual increase in the risk exposure itself. This chart is illustrating claims received by year over the last 10 years. Again, it excludes the health and social care sector. And it also illustrates our estimated liability against those claims. And that estimated liability, I suppose, is our best estimate of the potential cost of the claim, including the damages that may arise, any sort of legal costs or expert costs. On average, we receive about 36 claims per year in the state sector. And the higher estimated liability you see there in the orange line in 2017 reflects, I suppose, we received a higher number of claims in that year, but also a few outlier claims, hence why costs have peaked there. We have also excluded guarded compensation claims from this data set. And, we have assumed responsibility for guarded comp claims following the commencement of the Guarded Compensation Act in 2022. But we excluded them here just to avoid misrepresenting the underlying trends in general claim reporting. So look, just to talk you through a little bit more detail about our 2 risk research reports. As I mentioned, This report was on the state sector and was published in 2022. It was a 5-year review of incidents and claims across the sector. Just over 5,000 incidents fell into the scope of this report and 189 claims, and the estimated liability for those claims was in the region of 15 million euro. The awarded damages for claims was just under 37,000 euro, and the median cost of the claim, which would include legal costs, damages, and expert costs, was in the region of 44,000 euro. These next two charts illustrate instance by type of role. And starting with the claims, we can see that they're predominantly submitted by social workers, prison officers, care workers, mainly those working directly with service users. You'll notice very few claims from Garda Síochána here. As I mentioned, Garda claims were managed separately under the Garda Compensation Act scheme, which obviously came under our remit in 2022. The chart on the right shows incident activity. These incidents primarily relate to administrative and clerical staff, Garda members, prison officers. But when we look at the severity of the incidents, they are negligible in nature where no significant injury arose. These next two charts illustrate claims and incidents by problem cause. On the claim side, the majority of our claims relate to physical assaults on staff or harassment of staff involving frontline roles. On the incident side, we see a broader range of reported issues. We see those physical assaults, but we also see incidents arising in relation to intimidation and threat, verbal assaults. They rarely progress to claims. And it probably suggests that the behaviours are being reported more frequently and likely due to more awareness and the importance to report and a positive reporting culture within those organisations. These next two charts illustrate the claims and incidents by the type of injury. On the claim side, the majority relate to soft tissue injuries. We do see some psychosocial injuries also arising associated with violence, harassment, aggression, as mentioned earlier by Pádraig. It is an area that it is something that happens obviously with these, where we have a physical injury, but also potentially also a psychosocial injury that may arise, such as PTSD and anxiety or trauma. They can be costly in terms of their estimated liability. And I suppose it highlights the need for organisations to consider not just the physical harm that may arise from these incidents, but also the psychosocial impact on staff. And we have worked with the Health and Safety Authority to develop Work Positive, which you may be familiar with. It's a risk assessment tool designed to help organisations deal with psychosocial risks and critical incident exposure within their organisation. Looking at the incident data, it mainly involves pain, discomfort, or bruising. The vast majority of these incidents are negligible in nature, where no significant injury has occurred. Moving on to the health and social care sector, this is a report we finalised earlier this year. It was a 5-year review across the sector and it has been disseminated within the sector. The scope of the report was significantly broader in that there's a much larger data set here, 80,000 incidents and just under 400 claims. The estimated liability with these claims is just under 30 million euro. Interestingly, this was the median awarded damages of 27,000 euro and the median costs of 32,000 euro, slightly less than what we saw in the state sector. Legal costs, however, are higher. I think it was about 12,000 in the state sector, mainly probably due to the complexities associated with some of these cases and the duration of the claim as well. And just to give some context there, in the health and social care sector, from claim receipt to claim conclusion can typically last 1.9 years to just under 2 years, where in the state sector, it's about 1.6 years. So that's something that can contribute to the overall cost of that claim. But when we talk to people, there's a perception there that in the health and social care sector that violence, harassment and aggression is really an area localised to acute hospitals. But the data tells us a little bit of a different story there. So on the left-hand side here, we see a chart that illustrates incidents and claims received across the health and social care sector. The outer ring represents those incidents and claims represented by the inner ring. The light blue is reflective of the community sector, primarily disability services and mental health services. So the community sector represents 72% of the incidents and 66% of the claims. In contrast, the acute hospital sector is much lower. Incidence claims do arise there, but they tend to be more evenly spread across the hospital itself. The chart on the right, the light blue line at the top, illustrates these are incidents that occurred across the sector by year. We can see that, again, the community sector is a higher reporter of incidents, a notable dip there during the COVID years, probably reflecting the broader impact of the pandemic on community-based services. Incident activity, interestingly, in the acute side remains stable, and actually in both sectors have surpassed reporting levels prior to what we saw before COVID. Cultural issues and most likely also possibly a risk-related issue. This next chart is an illustration of, it's a scattered chart showing us, I suppose, incident claim activity by type of role. Healthcare assistants account for the highest number of claims, followed by nursing staff. Incident activity for healthcare assistants stands at 19%, which is a lot lower than what we would expect when we look at their claims at 33%. Potentially, there may be, a couple of explanations for this. They may possibly be excluded from some key communication channels. They may be less aware of reporting processes. There could be also gaps in training. I suppose it highlights the importance of ensuring that, all staff, regardless of role type, volunteers, agency staff, work placement students, are included in communication strategies that would also involve them, informing them about the reporting practices, for instance. So look, having considered the incident claim analysis, we also need to consider the financial cost. Our research team carried out a piece of analysis on the true cost of a claim. This study examined both direct and indirect costs that may be borne by employers as a result of a workplace injury. The analysis reviewed 30 claims, and the conclusion we came to that was that for every euro you spend on a claim, you're spending approximately 80 cents on those indirect costs. So what do we mean by direct and indirect costs? As I mentioned earlier, claim itself is made up of damages payments, legal costs, agency costs, and expert costs. Our indirect costs are looking at things like loss of productivity, loss of skills, replacement of staff, the cost of implementing corrective actions, all of which can contribute to the overall cost of a claim. And to take a case study as an example of this, which formed part of our study, this is a real life example. We examined one of the 30 claims, involved a healthcare assistant. They were physically attacked by a patient during a smoke break. The patient had a history of dementia and a history of volatile behaviour. They suffered soft tissue injuries, developed anxiety, PTSD, and they were out of sick from work for 13 months. What was important here is that they actually worked in a ward that at the time was not considered to be high risk. Thus, they did not receive any dementia or any VHA related training. The overall cost ratio for this particular claim was 0.89, so slightly above the average that we saw across the study. But I suppose it highlights how gaps in training and risk assessment can significantly increase the financial impact of an incident. So finally, before we wrap up, I just want to share some case study examples. Each case highlights key lessons around risk management and again, the true cost of the claim. So this first case study involves James, a clerical worker. He was verbally threatened and had a chair thrown across reception by a member of the public. Obviously, he was very shaken by the incident. He was off work for several days. The claim cost was in the region of 25 to 35,000 euro. And we've also illustrated potential indirect costs there. The total cost, the true cost of the claim, rather, I should say. So there were three key issues associated with this claim. The first was there wasn't any sort of risk assessment that was reflective of the situation that may arise, and they had failed thus to implement any valid control measures. In addition, James had not received any training to deal with violent or aggressive issues that may arise from members of the public. So the case shows gaps in risk assessment, physical controls, staff training, all can increase both the human and financial impact of that incident. The second case study involves Liam, a security guard who was called to assist in removing a violent client from a hospital. And during the intervention, he was assaulted. He was attempting to restrain him at the individual at the time. He sustained both physical and psychological injuries, and he was off work for about a year. Claim cost was in the region of 20 to 30,000 euro. There are two key issues associated with this claim. Training records for violence and aggression were last updated 10 years before the incident occurred, and there was no evidence of any refresher training carried out. And the incident report investigation that was carried out locally at the time did identify the need to implement corrective actions, to review the training programs, but no evidence of these reviews were carried out. Time of investigation of the claim. So it highlights the importance of maintaining up-to-date records, training, and ensuring corrective actions are properly documented and implemented. Our third case study involves Emily, a bus escort at a residential care home. Emily was physically attacked by a service user, resulting in both physical injury and anxiety, and the claim cost was in the region of 50 to 55,000 euro. The investigation revealed that the service user did have a history of volatile behaviour, and they had carried out a positive behaviour support plan, but this was not communicated to Emily. So I suppose the key lesson here is for any employee who interacts with service users, they must be fully briefed on risk assessments, the care plans, and involved, I suppose, in that risk assessment process in terms of what control measures are in place. And the transport of service users is a very common activity that happens across the state sector in the health and social care sector. Our last case study involves Anya, who's an employee working with clients with complex issues. And this is more of a positive outcome for us in the context of how the claim was concluded. During a meeting in the office, Anya was physically attacked by a client and sustained soft tissue injuries. So the claim was disputed and ultimately it was discontinued. The investigation found that the risk assessment was up to date. The client had no history of prior history of violence or aggression. There was a lone worker policy in place as well. Anya was aware of the policy, and I previously requested a colleague for other client meetings, so she was fully aware of what the practice was, but did not do so on this occasion. Thus, there was no negligence on the part of the state authority, and we were in a position to, I suppose, defend that claim. I suppose it illustrates how good risk management through up-to-date risk assessments, policies and procedures can help prevent claims or certainly significantly reduce the liability exposures. So finally, just to wrap up with a couple of key lessons learned, risk assessment was something we mentioned frequently during the presentation. It's really important these are obviously carried out, that they're relevant to the area that's where the potential hazard is, and tailored to the environment and the roles. Communication of policies and procedures, ensuring employees understand what's there and what's in place. Communication of service user care plans, similar to the situation we saw with Emily and transferring the patient. Ensuring that if there is a history of VHA behaviour, that they're aware of that. Training is critically important in maintaining records of training and learning from incidents. So, we see a huge amount of practice of good incident reporting. There's certainly a piece of work to be done to, improve the investigation side, because we know using this data and these reviews, it does help drive continuous improvement. So that sums up myself. Happy to take any questions. Thank you.